Hey guys, Dr. Segal here. What if I told you I'm going to cut in your scrotum, I'm going to make you sterile forever, it's going to be a super small incision, and we're going to joke around while I do it. Let's talk about vasectomy. Hey guys, so the question is, I'm getting a vasectomy tomorrow. I'm terrified. What should I expect? Okay, so let's talk about what your expectations should be for the vasectomy, how to kind of mentally prepare per se. And at the end, I'll talk to you about the one concept that I think it's important for guys to remember to help them get through a vasectomy and realize that it's something that's worth doing. Okay. So the first thing I tell guys is that this is a 30-minute procedure. It's something that oftentimes we will do in our office. So it's a relatively quick thing to go through. When you think about other forms of surgical contraception, especially for women, we're talking about a laparoscopic procedure sometimes with general anesthesia. It takes the whole day to get done. This is a relatively quick procedure. So if you can kind of wrap your head around the fact that you're only going to have 30 minutes of potential discomfort, try to remember that, number one. One of the things that kind of conveys how well tolerated it is that we will oftentimes do this procedure in the office. How many procedures can you think about that you could do in the office that have a long-term effect like this? Meaning that we are doing a permanently sterilizing procedure in the confines of our office during what sometimes is a very busy clinic. So if we can do it in the office, it just conveys to you kind of how low risk, how well tolerated it can be. So remember that concept too. I think that's an important one. The incision that, when I do a vasectomy, we're cutting the vas deferens. The vas deferens is here and here. We got to cut both of them because if we don't cut both of them, it won't work. But it's pretty remarkable that we're making an incision that's really, really small. It's like the size of the end of my pinky. That's how big the incision is. And we're able to negotiate both of these vas deferens through the incision and take care of them, cut them, burn them, clamp them, tie them off, bury them in 2 different layers. But this is a super, super, super small incision, and I think that conveys a lot of conveys what should convey to you guys is that this is a well-tolerated procedure because the incision is so darn small. Okay, this is another tip that it's hard for me to get guys to do this sometimes, but if you can do it, it's going to equal success in the vasectomy. Relaxed guys do better. All right, so that is certainly, and I say this all the time, this is easier said than done for guys. It's easier for me to say, just relax, you're going to be fine, than for them to actually do it. Having said that, if you feel like, Doc, I cannot relax, I am freaked out about this, I never have a problem, and I think a lot of urologists don't have any problem giving you something to relax you beforehand, like a medication for it. So don't be bashful about asking for that. I've had guys that get something that'll kind of calm their nerves beforehand, and they come into the vasectomy and they're super relaxed. They do great, and it's primarily because they had something to relax them beforehand. So most urologists are really, really receptive to that. Don't be bashful about asking for it, especially if you think it's the difference between you being able to get it done and not being able to get it done. I want you to remember too, this is the most common form of surgical contraception in the United States, and it's super common for a reason, right? Guys can tolerate it. It's quick. You can oftentimes drive yourself home. If guys couldn't tolerate it, it wouldn't be so common. In fact, I tell people, oftentimes the guys are so relaxed during the vasectomy. We're talking, we're joking around. Some of the patients I've learned most about in my 10 years of practice have been my vasectomy patients because we're talking the whole time. I'm learning about their hobbies, they're learning about mine, etc. So in general, that's the way a vasectomy goes. All right, guys, so my pearl at the end that I want you to remember is this. Usually, the pain of the vasectomy is less than the pain of having more kids. And if you could remember that, if you could think about that before, during, after the vasectomy, and put your mind there and think about all the difficult times you've had with your kids waking up at night, not eating their food, crying, arguing with each other, you're going to get through the vasectomy just fine. Remember, 30 minutes and you're going to do great. Less pain with the vasectomy than having more kids. Thank you so much for listening. You have the confidence. You're going to make it through it without any problem. All right? Know that. Thank you so much for listening to us. Please subscribe to our channel. We certainly appreciate it. Thank you.